It is my great pleasure to introduce a colleague, Dr. Geeta Swamy from Duke University. She is the Associate Vice President for Research, the Vice Dean for Scientific Integrity, and the Haywood Brown, MD, Distinguished Professor of Women's Health. She is a professor of obstetrics and gynecology in the Division of Maternal Fetal Medicine and serves as an associate vice president and vice dean. She works with leaders across Duke campus to provide a consistent vision for scientific integrity standards and expectations that drives efforts to ensure the advancement of scientific integrity. Her responsibilities include the Duke Office of Scientific Integrity, which includes the Advancing Scientific Integrity Services and Training Initiative, Conflict of Interest Disclosure and Management, Clinical Research Quality Management, Misconduct in Research, and Institutional Research Incident Response. She currently serves as the co-PI for Duke's NIAID vaccine treatment and evaluation, and for our CDC-funded Clinical Immunization Safety Assessment Project. Dr. Swamy is also a member of the Department of Health and Human Services National Vaccine Advisory Committee and the American College of OB/GYN Immunization, Infectious Disease, and Public Health Preparedness Expert Work Group. She's currently the president of the Infectious Disease Society in Obstetrics and Gynecology. Thank you so very much, Dr. Swamy, for your persistence and for coming along here, and it's so great to see you. Thank you so much. The floor is yours.
Thank you, Leah. All right, just also getting my technicalities set up here as well. So it's remarkable, isn't it, that we've gone through these now almost, I guess, 3 years of Zooming, and we still seem to never figure out if we're muted or unmuted and whatnot. So thank you all so much. And thanks for having me today. I'm going to maybe hone in on some of my views here on this issue and applaud you all for having this continued conversation and dialogue. But talk to you a little bit about my perspective and where things are from the standpoint of bullying in academia and behavior, professionalism in academia, where we've been and where I think we need to be going. So I don't work in this space, right? I'm not someone in culture, relationship, in management of the sort of hierarchical structure between, say, students, trainees, staff, and investigators or faculty or academic contributors. Where I do sit, though, is in a position over things in our research and regulatory space. And that is where I have learned a great deal over the last 4 or 5 years in how our federal sponsors and federal regulators in the academic and educational perspective are really thinking about how we need to move the needle, how we have to get behind what we've been speaking to with some sort of enforcement and compliance actions. It would be great if we knew and could trust in the fact that people know what is the right thing to do and to push that forward. I will say that a lot of people do know what the right thing is to do very often, but the incentives around them and the pressures around them often push them in a direction that they might not necessarily have gone had they had an easier route to get there. There's also a problem in the academic space where, at least from my perspective and training coming through things as a physician, and I say that because I'm not in the graduate space, more in the professional school space, where things, I bet, somewhat similarly, though, are quite hierarchical. And anytime you have that sort of structure, that you have a power differential, that you have high pressures to perform and produce and to move up and out, it's going to be in that sort of struggle constantly, right? In the push-pull, in the relationships, in the communication, in the credit, in the incentives, and in the accomplishment. And so how do we get there? What do we need to do? There are now policies coming forward that need to go along with the actions to follow that. We have to get to a place, though, where the leaders of our institutions, and at the top, as well as the mid-level leaders, and when I say that, meaning not just the presidents and the provosts of our institutions, but also the deans of our schools, the directors of our centers and institutes, the directors of our graduate programs, of our postdoctoral associate offices, and of our trainees in the graduate medical space as well, in residency training, fellowship training, medical students, and so forth, where all of those individuals have an agreement of what the expectation is in the culture and the training and the relationships. We can put forth policy, and we can put forth requirements, and we can put forth enforcement and punishment, and some sort of sanctions after the fact. But if people don't actually agree that this is the right thing to do, we're never going to be able to get to a place where people model the right behaviors to learn from. And so I come at it from the perspective of the compliance nature. We have been now doing lots with our federal sponsors, coming from Duke University, where we have a significant amount of NIH funding in the School of Medicine. There are lots of policies that have been put forward for enforcing a safe work environment, standing up against anything related to things that contribute to a hostile work environment, as far as bullying, discrimination, harassment, and things that are short of the definitions in our Office of Institutional Equity that have to demonstrate a continued persistent behavior. Things that are short of, how do you truly define when there has been a negative impact, right? It's all the microaggressions, all the little things that don't meet those definitions still contribute and just can't be accepted anymore. But at the same time, we have to change them from happening. It shouldn't be that we just look to see, someone has done it, and how do we now, implement something to point out why what you did was wrong, and now here's what's going to happen. We have to get to a place where we're actually making the environment safe from the start. So how do we set those expectations? How do we make sure people know that? And that was my actual interaction with Leah, or Dr. Hollis, was through some of the things that we've been doing at our institution to try to bring those things forward as part of our prospective way to ensure integrity and accountability in our research infrastructure. So how do we encourage individuals to speak up? How do we encourage them to bring issues forward in a way that they understand are important for their own career and their own learning, but also to help others around them for the next generation to come? How do we ensure that that speak up culture is protected? How do we ensure that speaking up prevents any retaliation or any negative impact on their career or their training or their education? So those are the kinds of things that we are promoting in the forward space. We also go through things from the research quality and integrity space to say, what's going on at the level of collaboration, authorship, data management, data sharing practices, because we also find that that is where things often the rubber hits the road, right? People are collaborating great on the idea, they're doing their projects. Then when it comes time to actually put those things outward, either with your name on something or to move on, and you want to continue to work in that, that's where the rub becomes, to say, oh, well, that was mine. You worked on that while you were here with me, but now that you're leaving, you can't do that anymore. How would that ever go forward, right? How about when we go forward to publish things and people have their names on that and they move their names around because of some sort of biased value judgment that might go into whose idea it was, who should get credit, as if there's credit in your name being first versus second versus fifth versus, what, so on and so forth. So those are the kinds of conversations that we are having. And I think the last thing I'll just say to sum that up is that these are conversations. There's no way to dictate this all through policy and expect that's going to work. There's no way to state this and expect that people heard it and now they have embraced it. They are conversations. They are sticky. They are tricky. They are tough. They are hard work, and they are time consuming. And what I mean by that is not all consuming in your day, but that it will take time to get to a place where we accept and understand these things across the board. We've gotten farther than we ever were. When I look at how things were when I was in residency training myself, which was now 20 something years ago, it was routine, expected, and normalized that we worked 100+ hours a week, that we thought that was a good thing. Um, I remember when things went through uh, structural change, say about in the last 10, 15 years now, to say that we should be considering what an appropriate number of hours that should be worked. And I was one of those people that said, this is ridiculous. We can't be counting minutes and hours. That's not how we learn. That's not how we care for patients. And maybe it's just having more gray hairs and more years under my belt that you look back and you go, why did I think that was normal? Why did I think that expectation was okay? What was it telling me that I had to accept that as the norm? And I will say that the pendulum swings back and forth, right? We need to keep in line with that, make sure that we're not going all the way to an extreme that is also sometimes stifling. What I will tell you is sometimes when we do count hours and minutes that someone has worked, it also can have a negative impact on their education and on their ownership of, say, a project or an issue or a problem or a patient, whatever it is that you're doing in front of you. So we still have to be reasonable. And the only way to do that is for people to feel safe, that they can speak up, about what's happened to them, about what they think should happen to them. They can speak up about what they've seen others engaged in and endured or experienced. So I think it really comes back again to everyone understanding and agreeing that we all need to work on this together. So that's where I come at it from my perspective, my experience, and where I sit now.
Great. Dr. Swamy, we have a question from the chat. The question is, what are some of your techniques to help get individuals to speak up, either at the student or faculty level? What do you suggest individuals move forward when they bring issues to the department, but they are brushed aside?
Yeah, it's a really good point. So I think, speaking up is, you do have to understand your environment, right? And where you are. And when I say the things that I was discussing, right, we have agreed to this as an institution, that we want to establish a speak up culture, that we want that to be encouraged. So you're right that how do you manage that if you take a question forward or take an issue forward and it's brushed aside? The concerns there are that, one, it could get brushed aside and nothing happen. The other thing is that it could be brought up and then you somehow are labeled, right, as someone who complained, or someone who is not a team player, or someone who's not understanding that this is just the way that it is, right? So I think my best guidance is to find, your trusted, safe space, right? Who are your advisors or your counselors or your mentors that you can trust to help you? And when I say that, I'm not talking about just from a standpoint of being a student, right? Like, I'm someone who's been in my career now for more than 20 years, and I still have mentors and still have colleagues that I consider as my trusted space. How do you get enough sort of bandwidth within your department or your school or your center to say, this is enough? Like, we have enough here together to talk about this in an intelligent way that you need to bring forward. If it's at the student level, I would really encourage you to seek out those individuals who are governing the educational aspects, those individuals who are identified as ombuds or counselors or leaders in the academic space. In the faculty level, not all schools have, but there should be opportunity to have ombuds, opportunity to have discussion with the faculty governance sort of structure, to figure out not a this happened and they did nothing and now this is a problem and we need to take this on, but more of, how do we address these issues as a faculty collectively? I don't know that a faculty governance sort of structure is going to fix a problem, an individual problem in an individual department. So I think it really becomes then about resetting the culture and expanding that. That's again what I mean by it takes a lot of work. It's not necessarily that easy for one individual in one space to always get what they need at the right time. We know that, right? We know that advocacy and culture change takes a long time, and a lot of things that we do don't necessarily always help us at that moment, but might help the next next person to come along the way.
I have a question for you, Dr. Swamy. For
Yes.
those who are in the executive or C-suite, as you will, in higher education, what strategies are best to convince them that the culture does need to change to avoid these threats to the science, to the well-being of the faculty and the staff? Because we know this doesn't just corrupt the science, it also is quite health harming. How do you,
Right.
what advice, since you do sit in a C-suite,
Yeah.
what kinds of things convince executive colleagues to change the culture?
Well, I think actually showing them real case scenarios can be helpful. Not just a complaint, right, or a concern or issue raised, but the downstream impact, right? So an example, when you see an issue with significant turnover in a lab, right? That could be because people are moving on. But how do you monitor that, right? How do you know that that's the reason? Are you doing exit interviews with individuals who are leaving your lab? I would tell you that we do a relatively okay job of that in the staff HR space. But even at Duke, we don't do a very good job of that with graduate students, say, who are leaving a lab prior to their thesis being completed, finding a new advisor. Sometimes that's the right thing. Sometimes people just don't click. Sometimes the idea wasn't what you wanted to pursue. But when you see it happening repeatedly, right, what is the issue there? And think about that from a provost perspective. Like, that's money lost, that's time lost, right? That's productivity that those faculty members have to keep churning and churning, and those students have to keep going for a longer period of time. That's more money for graduate school stipend. That's more money for, getting all of this stuff like in a churn that isn't being accomplished. And so I think, showing them at the institutional C-suite level, right? Where are their minds drawn to? What are their goals beyond saying that we want our academic institution to, what are the financial drivers, right? What are the reputational drivers that will ring true to them, that they want to see? For example, in some of the situations where we know we've had very, very poor behavior, and I'll go on out on a limb and say, bordering on things in the harassment space and discriminatory space. Let's face it, right? Our younger people today are not going to be quiet about those things, right? They're going to become vocal, and faculty will get reputations out there. If faculty have a reputation, that means their school or institution can get a reputation. And those are the kinds of things that I think that, again, it's not, and I don't mean to say this in like a threatening way to say, if you don't do this, and here's what could happen, but to actually demonstrate to them how things have happened, right? Show them those and how there are some things that we could do to improve upon that, right? Well, I mean, I think academia, there's a question here about a hierarchical society. I mean, that's tough, right? It's tough if the society around the institution is structured in that way. I'm not sure I have an answer to that from outside of, the institutional space. All I can speak to is the fact we have academic institutions here in the United States today that, quite frankly, are much more liberal than the community surrounding it. And that's what we're seeing today in, I think, unfortunately, the politics that are playing out. And so I think it's still a situation where we have to strive to be the best that we can be. So.
Do you see the second one, or would you like me to read that one back to you?
About the a person's experience.
The next one is how to report the case in a student level when gender equity offices and ombuds offices at the university and research is staying on the other side. How do you report those things when it seems like the support systems are on the other side of the complainer? That's what it seems to be saying here.
Yeah. Well, I think that's a tough one because, where we should be looking is that the institution, so what we're saying is that we don't feel like the institution is actually representing the values that the student feels are positive and are supportive of ending a bullying in academia sort of stance. I mean, that's a tough one. That really becomes then about whether it gets to the students together collectively to demonstrate that, the faculty together to demonstrate that. I think those are the kinds of things where it's really tough as one individual to be able to take that on if the institution has a perspective that is different. So, university presidents, majority are men. I'm not sure that is exactly the factor in how bullying continues. It depends on the university, the structure, and how the responsibilities are laid out. And why I say that is because there are presidents, provosts, chancellors. All of these titles have different roles and different responsibilities. It certainly is not so much just the case that presidents are men. There's mostly men still at the leadership level across all of those entities. Most department chairs are still men, right? Most deans are still men. So, and I would tell you that I think bullying is not necessarily just a male trait. I think bullying actually comes, or stereotypical trait, let me put it that way. I think bullying is still something that comes along with power. So if you look at the structure of academia, power comes along with the bullying, right? It's the people in those positions. I mean, quite frankly, many individuals would tell you that they were often bullied more so even by women than necessarily any other men that they interacted with. So I say that only because I'm not sure that the culture is necessarily inherent with the person at the top as much as the constellation of people at the top, because one individual is only going to set the tone of their sort of cabinet or leadership team. So I think it's more about how we get through additionally those mid-level positions also. So I think there's a question there about a leader, how to handle responding when it's a gray area of objective or subjective experience, right? So we've taken an approach at Duke that basically any sort of stated issue, concern, allegation raised, any of those sorts of things, we try to evaluate them and document them in the same sort of structured way, so that we try to come up with what the objective and subjective details may be to separate that from any one person's assessment. I think that's the only way to ever distinguish between things that are viewed by one individual, right? And making those sorts of decisions as well.
I have a question for you, Dr. Swamy. What have you seen organizations do with repeat offenders? I know in higher education, I've been in higher education, oh my God, 30 years, and it's nothing to say, oh, okay, so that person was a problem in student affairs, so we're going to move them to academic affairs, and they get to academic affairs. Okay, now we're going to move them to be a department or a special assistant. So we're really good at recycling our own junk. What advice would you give to C-suites, executives, and even middle managers about this repeat offender and how we tend to recycle them?
Yeah, that's a great question. We have, I don't know if you've seen that. So there's one thing about recycling them within the institution, and then there's another, what I also use, the passers on, right? Like, so somebody applies for a position, they call back for a reference and that kind of thing. There's been I think it's a tough one inside, right? Inside an institution, because that then goes back to sort of the culture that's there, right? And whether they see that as being acceptable. I always say that it's sort of failing upwards, right? Like somebody does these kind of things, and you see them continue to get promoted in a way that's incredibly disturbing. But one of the things is to consider, along the lines of like background check type of things and due diligence, but to actually include questions that are about behavior and professionalism. So the University of California has implemented across system-wide, almost like as part of, like, if you're applying to be a faculty member and you go through a whole thing, you get to a certain point in the process where they tell you that as part of moving forward, they need information from wherever you're coming from about whether you've been involved in any investigations, been found to have been involved in any misconduct or professional misconduct along the way, and that you have to sign essentially a release for them to ask those questions and get that information. I think University of Maryland has implemented that, and other schools are looking to implement something similarly so that we can avoid that passers on, right, type of approach. Because one of the issues we find is that when you have those kinds of people, they want to leave your institution and they go on, and sometimes nobody calls you to find out. Sometimes they give out references that they what's the word, cultivate, right, before they give out those names, and so forth. So I think it's hard within the institution, but certainly there are ways that we should be thinking about, what's the right process in place to do that.
So a follow-up to that, Dr. Swamy, would be, so if somebody is thinking of speaking up and they also have their eye on, say, the California system, as you just mentioned, does speaking up or being the complainant become something that you get dinged on when you go to California or University of Maryland, or only if you're the respondent in that complaint?
Only the respondent, and it's not actually if you were involved. I said it that way, but there's very clear language that they vetted through their, legal counsel and all that sort of thing. It specifically says things about I can't remember the wording, Leah, but it's specifically about whether there's been some action, right? Or there's been a finding or an action. I think that's usually how it says. And then there's the opportunity, right, to indicate any sort of improvement or correction, right? Because I think there's also the point here that we don't want there to be, this is, if appropriate, we won't want there to be permanence, right? Like we should be considering that there's an opportunity for people to improve in some situations and settings, right? If not, then we're actually in trouble, right? If we don't think people can improve from where they are today, then we have a lot more work to do. If we're not looking towards that as being one of the ways to get there. I see one about what is the most effective policy implemented. So I think one of the things that we have done, I'm not sure we've implemented specific, one thing that we've done is make very clear our policy against retaliation. So we have a stated policy. It's one page that specifically goes on Duke University's policy against retaliation. So that helps us in that speak up culture kind of perspective. So if someone were to speak up in good faith, right, like that they should be able to do that without fear of retaliation. When something like that comes up, if we begin any sort of assessment or investigation, we provide that statement directly to the individuals we're interviewing or communicating with. So they know it up front. We don't just assume that they know it because it's out there. We say, hey, we're assessing this situation. We try to keep things anonymous, but it's often, right, depending on what you're asking about, that might not be the case. So we always give forward our policy against retaliation. The other thing we've done is to try very much to communicate and socialize all of the federal sponsor policies out there now about requirements on safe workplace environment and requirements of reporting to them. So the idea there is we want to promote the speak up culture. We want people to be able to do that in a safe space. We also want people to know what will happen if they get reported to a federal agency about what they've done. So I know that's at the end, and it's not the way to encourage and ensure good behavior, but at least it's out there for them to know that some of this is beyond our institution making a decision. Like we actually have to follow those things as well.
If I may ask another question about your comment about the institutional agreement about culture and resetting the culture, who would you suggest is at the table when that agreement is cast? Who should be there? Just the executives, or how do you bring in the staff, or who gets to participate in, or who do you recommend should participate in that reset?
So You have to have everyone involved, right? But at the same time, you can't have every single person in the room. I think whoever the leaders are of the institutions that are in that space about institutional equity, so our Office of Institutional Equity is who would evaluate these things from the student perspective as well as the staff perspective. Folks in our human resources from staff and labor relations, right, to understand that. We have to have executives there, but we also need to have the real people, right? The faculty, the students, and the staff present. We need to have representatives there. And I think to your point, Leah, it's not like one room and one time, right? I think there needs to be continued discussions over the course of a period of time, and to put forth what are the goals? What's the objective? What's the work product that's intended here? Is it to establish policies? Is it to establish, understandings of how interactions are supposed to be? Is it a culture that we're promoting to say, how do we make people know what's happening, how to report things and so forth? So I think it's a long-term strategy to get to all of that, and not just any single sort of meeting or committee.
Okay.
Well, thank you, Leah and Morteza and Lorelei. Carrie, thank you all so much.